Let's start. Let's start. Everyone was here last week?
Yes. Yeah.
Except, let's make quick review.
Okay.
And then I will start. Also remind me to give you
Remind you about the microscope.
microscope.
Microscope, yeah.
For all the
Microscope, okay. Also remind me to give you here. You don't have to remind me. This is for the last week.
last week.
For safety and regulatory guideline. How many one studied the last week handout?
I did.
Really? How many one is lying to me?
Oh my God.
Okay. Let's see.
Yeah.
For safety workplace, working in the medical office, hospital, any medical facility, we have regulations, guidelines to follow in order to control the infection. It's called infection control, right? Mm-hmm. Very good. And also for the safety workplace, and also for accurate test results. So, how many things? 3. Infection control.
Mm-hmm.
Safety workplace. And accurate test results. Do you remember which organization responsible for this?
CDC.
Excellent.
Is Center
CDC.
of Disease Control.
CDC, this is stand for what?
For infection control.
No.
For
Center of Disease Control
Yeah.
and Infection. Very good. Center of Disease Control. Who is responsible for safe workplace?
OSHA.
OSHA. What's the OSHA stand? OSHA. What's the OSHA? Occupational Safety, Health and Health Administration. Occupational Safety and Health Administration. Who is responsible for this? CLIA.
Yeah.
Clinical Laboratory Improvement Amendment. Do you remember?
Yes.
Yeah.
Do you remember the CDC is a division of what? Public, United States, Public Health
Department.
Department. How about OSHA?
Department of Labor.
Department of Labor.
Labor. Yes.
How about CLIA? You always write
Health.
88 here.
Healthcare Federal Administration.
Healthcare Financing Administration, which is the branch from Health and Human Services, which is federal.
Federal, yes.
Very good. Do you remember the CDC? They made 3 guidelines.
Yeah.
The first guideline was in 1970,
Yes.
and it's called what? 7 isolation,
Oh yes, 7 isolation.
7 isolation categories.
Categories, yes. Strict isolation.
And then, okay,
Strict isolation.
they're here in your handout. And in 1980, they made what? Universal precautions. What do you think they made the universal precautions for? Because of was increased the incidence of
Diseases.
hepatitis B and AIDS.
Yeah.
In 1996, 1996-97, they made
Is 96 is general
Standard.
precaution.
standard precautions. So we have 3 precautions here made by CDC. What is the OSHA?
Occupation safety.
What the OSHA they made? They made the right to know law. To learn how to study, how to use the chemicals.
Yeah.
And they made different colors on the chemicals.
Yes.
Do you remember the white color?
The white
color.
yes.
Indicate what? You have to use the PPE, personal
Yes,
protective
personal
equipment.
protective, yes.
The red color, for fire.
Is a fire
Fire.
hazard. The
Blue.
blue is health hazard.
Health hazard.
Yellow is
Yellow is
Reactive.
reactivity,
Yeah.
unstable, instability of the chemical compound. CLIA is concerned with accurate test results.
Yes.
Okay, and now I believe you studied. Did I tell you to prepare 3 questions?
No for this class, for the next class, for tomorrow.
It's gonna be for this class also.
Okay.
Which is the question?
He's gonna give it to us on the like on test midterm. So he wants everyone to prepare 3
When you
questions.
start.
What do you want to study today?
What do you have to give us? You're gonna
Yes.
study Today.
Today we're gonna start the most important class,
Phlebotomy.
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 And take my advice, take my word. Don't miss any of these classes and take advantage, because I give you training time as much as you can, as I can, and if you're able to do it. Okay?
Pam, please come to the second floor, Pam.
Okay. Here. Congratulations.
Why you say that?
Like I give you a prize. My gift. Venipuncture or phlebotomy. Phlebotomy or venipuncture means bloodletting. You withdraw blood from the patient. Whose responsibility to draw blood from the patient?
The medical.
Medical assistant. Actually, it's not just the medical assistant.
Nurse.
Also nurse, the physician, and
PA.
phlebotomist, PA, yes. So many persons are allowed to withdraw blood from patients. You need some coffee?
Yes.
Yes. Please.
How do you feel now?
Feel much better.
Thank you. Okay. Listen, taking blood, it's easy to put the needle and you take the blood. That's good to do it, but this is not everything. This is not everything. You have to deal with the patient as a professional, expert, medical assistant.
The patient?
And the
You have to
with the
deal.
patient. And the patient will take an impression about your performance.
Yeah.
The patient is not going to judge the doctor. He's going to talk about you, going to judge you. Oh my God, the medical assistant's great, I didn't feel the needle. But he's not going to say, hey, I don't feel the stethoscope of the doctor, right?
The needle. She
The needle, because
the
it is,
needle.
yes, it's invasive procedure here. So you go inside his body. So if you do it professionally and with expert, they will love you.
But
And believe me.
malheureusement, nobody do it.
But how you going to do
Right?
it? How you gonna do it professional?
He gonna show you.
Believe
He's gonna
me.
show us.
Believe me, and the patient, when he coming next time, he gonna ask about you
Yes.
by the name. I need this girl to take care of me. And this is good message to your supervisor. Okay? So to take sometimes the patient is apprehensive or nervous.
Yeah.
And that's your role to make it quiet, to take the blood. Some patients, we call it the hard patients. They are not cooperative or troublemaker like you guys.
Oh my God.
But it's your role. Show your professional job, your professional behavior to calm down the patient to start to deal with them. Is that clear?
Yeah.
Very good. Dealing with phlebotomy is different than before. Long time before, they used to take blood from the patient because they think it's a bad blood. They just leave the blood and throw it away because they think it's a bad blood and the patient's sick because he has some bad blood. So when they take some blood and let it go, and they think the patient will be better. But now it's changed. The theory is changing. Now we're taking the blood for different reason. Why we taking the blood for?
For test it.
The first, yeah.
It test for different disease, ailment.
For diagnosis.
For
right?
diagnosis, the diagnosis.
For diagnosis, very good. We have different kinds of
Disease.
different purposes for the test disease, not just for diagnosis, sometimes also for follow-up. To follow up, if someone having disease like hypothyroidism or diabetes, and they're receiving a medicine, and they have to adjust the dose. They have to do the blood tests frequently to see if the dose is enough, right? To increase the dose, to lower the dose. It depends on the result of the blood test. Okay? And for other reasons. Sometimes they do the blood test and for checkup. Someone is going to the medical office for just regular checkup, and they do blood tests. And they discovered, oh, you are diabetic. And he wasn't aware that he was a diabetic.
Oh.
So discover a new disease, the patient having a disease and the patient is unaware of it. Blood test. Okay? Diabetic patient, they don't have pain. Diabetes doesn't cause pain, so the patient doesn't feel it. Very good. Dealing with the, also we have other reasons like differential diagnosis. Sometimes two diseases they give the same symptoms.
The same symptoms.
Same symptoms, and they have to do blood tests for differentiation between these two diseases. Okay? Dealing with phlebotomy, what you dealing with? Which system? We have cardiovascular system, we have digestive system, we have nervous system, urinary system, integumentary. Which system
You have reproductive too?
Cardiac.
Because no, the heart,
Nervous.
For the
cardio.
cardiovascular. Yes.
with the circulatory system?
Circulatory.
What about reproductive system?
What's the problem with the? Oh, you're taking blood from reproductive
Blood.
system?
Oh no.
They say for the blood. He's talking about the blood.
Oh my gosh. I didn't know you were talking about blood. Extra credit for me.
Okay.
Oh my god.
This is diagram for the circulatory system.
Your heart is very beautiful.
Extra credit.
I have one here. Look at
Look at this.
Diagram for circulatory system. Heart.
Yes, the heart.
Circulation. Here, the heart having how many chambers?
Two.
two.
Four
There are
chambers.
four chambers.
Thank you.
Yeah, four, yeah.
Four chambers. Two on the top.
Yes. They call smaller, and the
They call it atria.
yes artery.
Atria or atrium?
You take it less used.
Oh, yeah.
Is that atria or atrium?
Atria.
The preview of atrium.
What's the difference between the two words here?
The preview.
One is plural and one is
Plural
singular.
and
Which one is
singular.
plural?
Atria and atrial is single. Is plural. Atrial.
Listen
is
to me
singular
and tell me.
atria is plural.
Listen to me and tell me. We have right atrium, left atrium, both atria on the top.
E is for the plural. Yeah.
Atria is the plural and the atrium is the singular.
Thank you. And two ventricles in the bottom here. That is the four chambers of the heart. Two atria and two ventricles. When we talk about the heart, we talk about what? Right side and left
And
side.
left side, yeah.
And they are separated by septum here.
Yes.
The right side, what color of right side here?
Blue color.
Blue color.
Yes.
What
Red.
color is here?
Red color.
Why we do that?
Is from the
It's
the
because
blood clean and the blood.
it's because of the globins.
No, it's from the the circulation is between oxygen and dioxide carbon. I remember from school.
Okay.
But the red have the good blood, but the blue have
Bad blood.
bad. Yes, they call.
So here is bad blood and here is good blood.
Yes. Yes.
I think they have.
Okay.
Yeah.
Okay. Here, the right side of the heart dealing with deoxygenated
Deoxygen,
blood.
Yes.
Lack of oxygen. A blood with lack of oxygen.
Yeah, like.
The left side of the heart here is dealing with oxygenated blood, rich in oxygen.
Rich.
And that is why the deoxygenated and oxygenated blood, they don't mix with each other. Very good.
Can you repeat the doctor, please? The left heart.
Right side of the heart deal with deoxygenated blood, and the left side of the heart deal with oxygenated blood.
Deal, the right side of
The left side with
Oxygenated.
the right side deal with the
Deoxygenated.
the
D means less,
less.
lack
less.
of oxygen.
You said deal with the oxygenated.
Left side.
What about right?
Deoxygenated blood.
Very important information.
Here is a it's hard to say deal, carry. Carry deoxygenated blood, and this is carry oxygenated blood. Okay.
You said the left side deal with what?
Deoxygenated, and the left heart carry the oxygenated.
You talk about the left side?
Yeah.
Oxygenated.
Left side oxygenated, the right side is deoxygenated.
Yes. Well, everyone is reactive today. You want me to give everyone A today for the classroom activity?
Yeah.
Yeah.
Yeah,
Okay.
We
because
love you so bad, you know. So
Heart, my heart. Okay. Here is the story. The right atrium is connected to two big veins, the biggest vein in the body. It's called superior and inferior vena cava.
vena cava.
Superior. This is the superior vena cava, and this is the inferior vena cava. They carry what? What blood? Deoxygenated blood to the right atrium. And through tricuspid valve, it goes to the right ventricle. Tricuspid valve, right ventricle. Through pulmonary semilunar valve to the pulmonary circulation.
What is the biggest vein name? Superior.
Vena cava inferior.
Superior vena cava,
Inferior.
inferior vena cava. They carry deoxygenated blood to the
When they
right
are right
atrium.
side.
Yes, to the right atrium.
From
And when
The superior.
the atria contract, the blood is pushed through tricuspid valve to the right ventricle. When the ventricles contract,
They form.
listen, the heart muscles here, the heart muscles, the heart is formed of muscles, and the function of muscle is contraction and relaxation, right? For the skeletal muscle, you say, contraction and relaxation, that is normal. But here, for the heart, contraction and relaxation, we have different expression. We say systole and diastole.
Yeah.
Systole means contraction, and diastole means relaxation.
Can you write it, please, doctor?
You said the superior.
Right what? Systole,
Yeah, please.
systole and diastole.
You said the superior and an inferior vena cava carry the deoxygenated blood.
Systole.
And diastole.
I'm sorry, I didn't hear you.
You said the superior and inferior vena cava carry the deoxygenated.
Deoxygenated blood.
Systole
the-
is mean.
That means lack of oxygen, not enough oxygen.
Not,
The The systole and diastole. What
And
they-
diastole.
Systole means contraction of the heart muscle, and diastole means relaxation of the heart muscle. Now I can tell you, instead of saying contraction of the heart, I tell you what, during ventricular systole, the blood is pushed through.
What you said is systole and what you said was
Diastole is a reaction for the
Systole
the-
is contraction,
Systole is
and
contraction.
diastole is relaxing.
Oh,
It's
contraction and relaxation. Okay.
Relaxation. Relaxation. Don't change the medical terminology.
relaxation.
Nothing
the
called a
spelling that-
relaxation.
Okay,
Relaxation.
write the spelling then.
Spelling what? Spelling of what?
What's medical term you said we pronounce it wrong?
For which?
Relaxation.
Relaxation?
Relaxation.
And what's the other one you said?
Another one,
I remember
relaxation.
I
This
have
thought
it
is
here.
relaxation.
Diastole means relaxation.
I
Of
have
the
it-
muscle.
Systole means contraction.
I have it in medical and clinical procedure too, but I forget. I have it in my notes right now.
Contraction of the heart, of the muscles of the heart. Because he said don't change the medical term. And yes, totally.
You finished with that?
Yes.
Yes.
Thank you, Doc.
You're right.
This information, share this information.
What is the name of this valve? Tricuspid valve. So the blood moves from right atrium to the right ventricle through which valve? Tricuspid valve. And then during ventricular systole, and the blood, it moves through to the pulmonary circulation through this valve here. It's called pulmonary semilunar valve. To the lungs. It's called pulmonary because it's going to the lungs, and the medical terminology for lung is pulmonary artery. And then in the lung here, what is the function of respiration? Gas exchange. You eliminate the carbon dioxide and you take the oxygen, right? When the blood is oxygenated in the lung and it returns back to the left side of the heart. Now it is oxygenated. That is why it is red color here. Through 4 pulmonary veins to the left atrium. And then from left atrium to the left ventricle through this valve. What is the name of this valve? Mitral valve. Flush. Through mitral valve. Mitral valve is bicuspid, not tricuspid like this. Bicuspid. Okay? Also, during ventricular contraction, and the blood now, oxygenated blood, goes through aortic valve, aortic semilunar valve, to the aorta, to all over the body. So the heart takes deoxygenated blood, but pump it again as oxygenated blood. Any questions so far? What is so hard about this? Before we leave this,
The material value.
huh? mitral valve. This valve between the left atrium and left ventricle is called mitral valve. In order not to get confused between the different valves, this valve here, look at the right side. If you look at the valves, you find two valves at the periphery and two valves at the center here, right? Two valves are outside here and two valves are inside. The two valves are inside, they are semilunar valve. You know what semilunar means?
Similar.
Similar? Like similar? No.
No.
You hear by similar.
You know what the lunar?
Yeah.
You need a moon. Okay. Let me show you, if you cut this part here, when you remove this part, and you take this, look at this part here from the top. From the top. Can you imagine this? When you remove this, all this part here, now you can look at the top of these valves, right? From the top. You know what you're going to see? You're going to see a disc like this, disc like this,
Yes.
having four valves. This is a septum. Septum.
Like what?
And we have, this is the four valves. This valve is here.
Yeah.
And then next one is here, and on the right side, this here. Okay? We call this
Imagine if
we call this tricuspid valve.
Tricuspid.
What's tri means?
Three.
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 yeah.
Cusp means three extensions or three doors. Okay? One door, two, three. They open and close together. And that's why they call it tricuspid valve, because they have three cusps. Okay? And this one also in the periphery, it's bicuspid, it's called mitral valve, but it has two cusps, that's why it's bicuspid valve. It's called mitral valve. So here, tricuspid, this one,
They say,
and this one is called mitral valve.
or bicuspid, right?
Bicuspid means having two doors.
Yeah.
Bi, two. Here is three. Look at the two here in the middle. This one is here. It goes to the lung, right? It sends blood to the lung.
Pulmonary.
And the medical terminology for the lung is pulmo, right?
Pulmonary valve.
Pulmonary valve. But the pulmonary valve and the aortic valve, the cusps doing like this, like happy face. Like the moon, half moon. And that's why we're semilunar valve. Okay.
Like you said in French, la lune.
La lune, yes.
La lune.
Oh,
La lune.
Oh, la lune.
Laline.
Yeah.
Oh, lune.
La lune, not
Not your French.
You said no lune.
Yeah.
La lune.
Oh my gosh.
I understood what you meant. That's why Alex.
Unbelievable, right?
You need some coffee.
Yes.
Yeah.
You really speak from French for real?
Yeah, because I was in Catholic school.
Oh, okay.
For real, you see she's
One
speaking,
time-
talking about for real?
One time
Crazy.
I was talking to a woman
Oh.
and I told her, choose one of two. You want to give you a cup of coffee or a hug? And she said, no, I don't like coffee.
I like her.
Okay. Are you ready?
Yes.
Okay. Let's start from aorta. You see the aorta? The aorta arises from which part from the heart, but from which room of the heart? From the left ventricle. Right? The aorta originates in the left ventricle. It takes blood, carry blood from the left ventricle to all over the body. Right. Does it give blood to the... This is the heart muscles here. This is the heart. This is the heart. Push the blood. Very good. Is the aorta supply blood all over the body? Yes.
Yes.
Does it supply also blood to the heart?
Yes.
Yes.
So it supply blood to the heart through a circulation called, what is the name of this circulation? Coronary circulation. Coronary circulation. If you look at the aorta here, you find the aorta is arising from the heart, from the left ventricle, and goes up.
What about that's called pulmonary circulation?
No, we're talking about aorta.
Aorta, there's nothing with the...
Pulmonary on the left, on the right side of the heart. This is on the left side of the heart.
In French,
Yeah.
not understand.
Hmm?
What?
She's gonna fail if you don't understand.
I tell him the French.
Yeah.
When he told me, tell me in Arabic, I tell him.
You want to teach you French?
Oh,
You wanna
He
learn
speak
French?
French.
You speak French?
yes, I do.
Where are you from?
Hey, you
I
don't
see.
speak good French.
Haiti?
Yeah.
I eat.
Haiti speaking French?
Yeah.
Yeah, but
French
not a
and
good one.
Creole.
Creole and French. Hey, they speak Creole. Creole is like half of a broken French.
Yeah, broken French.
French.
Broken.
Oh, okay.
You already know.
You already
Oh,
know.
très bien. Très bien.
Oh,
Yeah, très
extra
bien.
credit. Extra credit.
Écoutez.
Oh
Écoutez,
my
okay.
gosh.
Okay. Attention.
Yes.
You see, Havana, you speak, you see?
Okay.
That's nice.
This is aorta arise from the left ventricle. It takes oxygenated blood, rich in oxygen, and also rich in nutrients, and distributed all over the body. Okay. When you look at the aorta, you find this aorta is going up. You know what is the name of this part? Ascending aorta.
Ascending out.
Ascending aorta. You know what is the name of this aorta?
Descending.
Descending aorta. You know what is the name of this part of the aorta? It's called arch of the aorta. Okay. So from ascending aorta, it sends branches called coronary branches to supply blood to the heart muscles. Is that easy?
Yes.
Okay.
We're gonna take